Hi guys, this is Caroline Pellegrino. I'm psychiatric nurse practitioner out of California. We have a very good topic that I want to talk about today, and the question of, is it appropriate or professional to cry with your patient? So that's what I want to talk about today. But if this is your first time in this channel is about being a psychiatric nurse practitioner, the struggles, the joy, the good, the bad, and the ugly, and the amazing things about it. And my goal is to empower you with the lessons that I learned throughout this journey of being a psychiatric nurse practitioner. I'm actually 5 years in as of this time, 2020. I graduated in 2015. So hopefully you stay tuned so we can talk about this really important topic.
Okay, so is it professional or appropriate to cry with your patient who's in front of you struggling? And actually patients come to our clinic because they're struggling emotionally and may have a history of psychiatric disorder, or this could be their first time having a psychiatric disorder because of the situation that they're in, right? And in a given visit, sometimes and a lot of times patients pour their heart out and they give you information that otherwise they wouldn't tell anyone, and this is something that has been deeply rooted in them, and sometimes it really triggers us, not in a negative sense, but it affects us, right, emotionally as well. So is it appropriate to cry with a patient when they're talking about something that's really painful and you feel the same pain that they have? You're able to empathize? Yes, it is totally appropriate. And let me give you some of the guidelines as to what makes it appropriate and when it is not appropriate. Okay, so one important thing is we are not robots, right? They talk about their feelings and their struggles and their history, and we're also human beings, and we also can feel the way they're feeling. Maybe we have a history that's similar to their history, and that can also be affecting us. So we too have emotions, so that's why it's completely appropriate to shed some tears. Number two, it can be validating to the patient, showing them that they have all the right to feel the way they feel, and how you also can share in that experience. Number three, it showed the patients that you care and you can connect at a much deeper level, and it also shows the patient that you really listened attentively to them, right? Number four, one thing that makes it not appropriate is when you cry harder and louder than the patient, when you get so triggered that you cannot stay in the room with the patient and continue the visit with the patient. Totally not appropriate, right? This time is for them. It's okay for us to have an emotion towards that, but it's not okay if you are crying harder and louder than the patient and the patient has to go, oh my God, I'm so sorry, right? So that's not okay. That's where the boundary stops. Do not use it as a tool to connect and validate. I mean, there's so many different ways to connect and validate patients, and crying is not one of them. So if this has been a pattern for you where in order for you to connect and validate the patient's feelings, you cry and you shed some tears, this is not the right way to do that, definitely. This is only appropriate when it's actually genuine and spontaneous, not an actual tool that you use to be able to connect with the patient. And do not do it frequently, okay? Patient comes to you, same patient follow-up, and they're talking about something that's really difficult and hard, and you cry again, right? The patient may feel unsafe that she is or he is triggering you, that you're, be kind of sensitive about that, what he or she's talking about or what they're talking about. So it's really important that you do not do it frequently. This is not something that has to be done frequently. Once, definitely appropriate. I actually had an experience when what's hard for me is seeing kids struggles, teenagers, and I've had an instance where a teenager was talking to me and his trauma and his struggle, and I just could not afford to not cry, and I tried my very best to hold my tears, but sometimes the more we hold it, the more it comes out, and so it just started pouring. I wasn't crying louder, but you know, it just poured because of how I felt for that kid. So you know, those times it's definitely it's appropriate, and I think it's really important that you be open to the patient, because they will see it, right? You be open to the patient and say, I feel you. You probably can see that I have some tears that I'm shedding, and I understand where you're coming from, and you know, just talk it out with the patient, but not, you know, process it with the patient, because that's not something that's their job to do. But just kind of open it, kind of say, you know, this is what I feel, and I shed some tears, and you know, I think it's totally appropriate that way. So if you are able to stick with those guidelines, I think it's totally appropriate to cry with the patient. And I have done it a few times. I don't remember doing it, you know, many times. I think it's really important, though, we not use it as a tool. And also sometimes when we get triggered, it's because we are going through something too that is difficult for us to put aside until after work. So it's something that you need to check in if you feel that that's happening a lot more often. Not that you're using it as a tool to connect, but if it's happening a lot more often, then there's something that's going on with you that you probably need to address, you know, outside of your visits with the patient. Maybe, you know, do therapy and something else. But it's something that we can talk about some more later on. But those are my guidelines as to when it is appropriate to cry with your patient. Okay, so if you guys think that this video is helpful, please like and comment. And if you want to hear more or see more videos later on, please subscribe and hit the bell button so that I can be able to share some more information with you. Okay, take care. And that's Coco being loud. Okay, bye.